Welcome to Top Wise. Today, we'll discuss 15 signs of vitamin D deficiency. Vitamin D is important for keeping your bones and teeth healthy, making sure your immune system works well, and controlling how cells grow and divide. Additionally, it contributes to the creation of insulin and the proper functioning of muscles. Several diseases and conditions, like rickets and osteoporosis, have been linked to not getting enough vitamin D. Watch this video all the way through to find out if you need to take more vitamin D. Number 1. Fatigue and tiredness. Fatigue and tiredness are common symptoms of vitamin D deficiency. This is because vitamin D helps control how much calcium and phosphorus are in the body. These minerals are important for keeping bones and muscles healthy. If you don't have enough vitamin D, your body might not be able to absorb enough calcium and phosphorus, which can make you feel weak and tired. Low levels of vitamin D have also been linked to depression, which can lead to tiredness. If you're experiencing fatigue or tiredness, it's important to speak with your doctor to determine the cause and if a vitamin D deficiency might be a contributing factor. Number 2. Bone or back pain. Bone or back pain is a symptom that can be caused by a deficiency in vitamin D. Vitamin D helps the body absorb calcium, which is necessary for strong bones. Without enough vitamin D, the body cannot absorb enough calcium, which can lead to weak bones and bone pain, particularly in the spine and hips. If you are experiencing bone or back pain, it is important to see a doctor to rule out other potential causes and to determine if a deficiency in vitamin D may be contributing to your symptoms. Number 3. Depression or anxiety. Depression and anxiety are mental health problems that can be caused by many things, such as not getting enough vitamin D. Studies have shown that having low levels of vitamin D makes you more likely to get depressed or anxious. Vitamin D plays a role in regulating the release of certain neurotransmitters, such as serotonin and dopamine, which are chemicals in the brain that affect mood. Not getting enough vitamin D can throw off the balance of these chemicals, which can lead to depression and anxiety. However, it is important to note that depression and anxiety can be caused by a complex interplay of genetic, environmental, and psychological factors. Number 4. Slow wound healing. Slow wound healing is a symptom that can be caused by a deficiency in vitamin D. Vitamin D plays an important role in the healing process by promoting the growth and differentiation of skin cells. It also helps to regulate the production of collagen, which is a protein that gives structure to the skin and is essential for wound healing. Low levels of vitamin D can slow down the body's ability to heal and make it harder for it to fix broken tissue. Additionally, vitamin D also helps modulate the immune system, which is critical for fighting infection and promoting healing. However, since slow wound healing can also be caused by other factors such as poor nutrition, diabetes, and other medical conditions, it is important to consult with a healthcare professional to identify the underlying cause of slow wound healing and to determine the best course of treatment. Number 5. Muscle pain or weakness. Muscle pain or weakness is a symptom that can be caused by a deficiency in vitamin D. Vitamin D helps the body absorb calcium, which is needed for muscles to contract and move. This is how it helps muscles work. Low levels of vitamin D can lead to muscle weakness and pain, particularly in the legs and lower back. Additionally, research suggests that vitamin D deficiency may also lead to muscle wasting and weakness, especially in older adults. It may also cause an increased risk of falls, which may lead to injuries. However, muscle pain or weakness can also be caused by other factors such as injury, certain medical conditions, or certain medications, so it is important to consult with a healthcare professional to identify the underlying cause of muscle pain or weakness and determine the best course of treatment. Number 6. Hair loss or thinning. Vitamin D helps hair grow by controlling how much new hair is made and speeding up the growth of hair that is already there. Low levels of vitamin D can stop hair from growing and make hair thin or fall out. Studies have also shown that not getting enough vitamin D is linked to alopecia, an autoimmune disorder that causes hair loss. But hair loss or thinning can also be caused by things like hormonal imbalances, stress, genetics, and some medical conditions. It's important to talk to a doctor about hair loss or thinning and find out what's causing it and the best way to treat it. Number 7. Soft, brittle, or misshapen nails. Vitamin D plays a role in the health of nails by promoting growth and strength. Low levels of vitamin D can lead to weak and brittle nails that are more prone to breaking or splitting. Additionally, vitamin D is essential for the absorption of calcium and other essential nutrients that are important for the health of nails. Therefore, a deficiency can also cause malformations in the nails, such as ridges, dents, or discolorations. But soft, brittle, or misshapen nails can also be caused by other things, like fungal infections, eczema, or other medical conditions. It's important to talk to a doctor to find out what's causing the problem and what the best treatment is. Number 8. Impaired immune function. Vitamin D is important for the immune system because it controls how many white blood cells are made and helps the body fight off infections. Low levels of vitamin D can lead to a weakened immune system, which can make it more difficult for the body to fight off infections. Vitamin D deficiency has been linked to an increased risk of respiratory infections, such as pneumonia and flu, according to research. Additionally, vitamin D also plays an important role in modulating the immune system, helping to balance the immune system response, and decreasing the risk of developing autoimmune conditions. However, impaired immune function can also be caused by other factors such as chronic illness, stress, and certain medications, so it is important to consult with a healthcare professional to identify the underlying cause of the problem and determine the best course of treatment. Number 9. Mood swings or irritability. Vitamin D helps control the release of neurotransmitters, which are chemicals in the brain that affect mood and include serotonin. Low vitamin D levels can throw off the balance of these chemicals, which can lead to mood swings, irritability, and other mood disorders. Studies have shown that people who don't get enough vitamin D are more likely to get depressed, anxious, or have other mood disorders. But mood swings and irritability can also be caused by things like stress, hormonal imbalances, and certain medical conditions. So it's important to talk to a medical professional to find out what's going on and what the best treatment is. Number 10. Frequent infections. Vitamin D is important for the immune system because it controls how many white blood cells are made and helps the body fight off infections. If you don't get enough vitamin D, your immune system can weaken. This makes it harder for your body to fight infections. Studies have shown that people who don't get enough vitamin D are more likely to get respiratory infections like colds and the flu, as well as other types of infections like UTIs and sepsis. Vitamin D is also important for balancing the immune system and lowering the risk of developing autoimmune diseases. But frequent infections can also be caused by things like a long-term illness, stress, or certain medications. So it's important to talk to a doctor to find out what's going on and what the best way to treat the problem is. Number 11. Infertility or irregular periods. Vitamin D helps control the hormones that make ovulation and periods happen. Low levels of vitamin D can throw off the balance of these hormones, which can lead to infertility and periods that don't come on time. Studies have shown that women who don't get enough vitamin D may have a harder time getting pregnant and may have a higher chance of having a miscarriage. Vitamin D deficiency has also been linked to menstrual problems like amenorrhea, no periods, and dysmenorrhea, painful periods, painful menstruation. But things like hormonal imbalances, stress, and some medical conditions can also cause infertility or irregular periods, so it's important to talk to a doctor to find out what's going on and the best way to treat it. Number 12. Inability to lose weight. Vitamin D can help you lose weight by controlling your metabolism and how your body stores fat. Low vitamin D levels can throw off the balance of these processes, making it harder for the body to lose weight. Studies have shown that people who don't get enough vitamin D are more likely to be obese and have a higher body mass index, BMI. Also, vitamin D has an effect on how insulin works. Not getting enough vitamin D can cause insulin resistance, which can lead to weight gain. But not being able to lose weight can also be caused by other things, like a bad diet, not getting enough exercise, or certain medical conditions. It is important to talk to a doctor to find out what the problem is and what the best treatment is. Number 13. Difficulty concentrating or brain fog. Vitamin D helps brain cells grow and makes neurotransmitters that affect mood and brain function. Low levels of vitamin D can throw off the balance of these chemicals and lead to cognitive dysfunction and brain fog. This makes it harder for the person to focus, remember, and concentrate. Studies have also found a link between not getting enough vitamin D and having a higher risk of cognitive decline and dementia. But brain fog or trouble focusing can also be caused by things like stress, not getting enough sleep, or certain medical conditions. It's important to talk to a medical professional to find out what's going on and what the best treatment is. Number 14, dry mouth or constant thirst. Vitamin D helps keep the body healthy as a whole. If you don't get enough of it, you might have a dry mouth and always feel thirsty. A dry mouth can happen when the flow of saliva slows down. It can make it hard to swallow and talk, and it can also increase the risk of tooth decay and infections. A dry mouth can make you lose more water from your body, or your body may try to make up for the lack of fluids by making you thirsty all the time. But other things like diabetes, certain medications, and certain medical conditions can also cause dry mouth or constant thirst. So it's important to talk to a doctor to find out what's causing the problem and what the best way to treat it is. Number 15, darker skin pigmentation. Vitamin D helps control how much melanin your body makes. Melanin is the pigment that gives your skin its color. Low levels of vitamin D can throw off the balance of how much melanin is made, which can make your skin darker, especially in the areas that get a lot of sun. The name for this is hyperpigmentation, but darker skin pigmentation can also be caused by things like sun exposure, hormonal imbalances, and certain medical conditions. So it's important to talk to a medical professional to find out what's going on and what the best treatment is. Thank you for watching, and don't forget to like, share, and subscribe to our channel.